Assalamu alaikum. My name is Abdul Hanan from A1 Morning 2021 DVM 038. Today, my case of discussion is ovulation induction in greater one horned rhinoceros. This presentation covers a case report on inducing ovulation in greater one horned rhinoceros. The study by Humes and colleagues tested two hormones, HCG and GnRH, to help a female rhino that was not ovulating naturally, a big step for conservation breeding. Overview of the study. Captive breeding is vital for rhinos conservation, but many females struggle with fertility. This study looked for a reliable, safe way to trigger ovulation using hormones. The goal was to make breeding more successful in zoos. Reproductive issues in GOH rhinoceros. Many female rhinos have irregular or silent estrus cycles, making breeding difficult. They also develop reproductive tumors early in captivity. That's why finding a way to induce ovulation is so important for proper management. Objective of the case. The main aim was to test whether HCG and a GnRH analog called histoline could trigger ovulation in an anovulatory female. The researchers tracked hormone changes and ovarian activity to evaluate the treatment's success. Study animal. The study involved a 12-year-old female greater one-horned rhino at Vienna Zoo. She showed hormonal signs of cycling but never ovulated. Continuous monitoring since age 4 provided excellent baseline data. Hormone monitoring methods. Fecal samples were collected twice a week and tested for hormone metabolites that reflect estrogen and progesterone levels. These helped identify when the rhino was in her follicular or luteal phase before and after treatment. Statistical analysis. Day 0 was the injection day. Hormone data were analyzed in 3-day intervals before and after treatment using the Mann-Whitney test. Differences were considered significant at a p-value below 0.05. Results summary. Out of 11 treatments, even successfully triggered ovulation, about 64% HCG worked best, with a 75% success rate, while GnRH succeeded once. No visible behavioral stress was observed during any treatment. Hormonal findings. Successful cycles showed a clear rise in estrogen before ovulation and a sharp increase in pregnant afterward. Failed attempts had consistently low hormone levels. These patterns confirmed true induced ovulation. Comparative results. The rhino's ovulation rate with HCG was similar to mares, where success reaches 80%. White rhinos show about 67% success with HCG, so these results fit well and show potential for broader use in other species. Discussion. This study proves that HCG can effectively induce ovulation in rhinos that fail to ovulate naturally. It also highlights that hormonal and ultrasound monitoring are more reliable than behavioral science alone. Practical implications. Using HCG could improve breeding in genetically valuable females and boost reproductive success in zoos. It's a simple, low risk method that can be applied in facilities with proper equipment and trained staff. Conclusion. In summary, HCG induced ovulation in most treatments while GnRH was less consistent. Regular use of HCG could support artificial insemination and natural mating, helping sustain captive rhinos population. Ethics and acknowledgements. This study was ethically approved and all animal procedures followed strict welfare standards. The team worked collaboratively across institutions and declared no conflicts of interests. Thank you.